Yeah, those peptides work really well. I mean,
I remember when peptides got popular, I was like skeptical about them at first. Now, like anecdotally, just through myself, like I've taken so many different ones. I've seen so many different benefits.
in my exposure to medicine over the last like 10 to 12 years, stuff has like progressed pretty rapidly. I actually had one patient that had heard about it recently and asked me if we could if we could source it or find it.
All right, welcome to the Health Shift. We are doing a podcast that is going to be focused on, kind of the shifts in medicine, the shifts in, training and health and wellness, just how the world's evolving and just everything that comes along with that. My name is Domenic Kuza. I do advanced practice education for Relive clinics, and Dr. Pat
Nolan. Ironically, we're both from Michigan.
Yeah.
Went to Michigan State for medical school, did my residency in West Palm Beach, board certified in family medicine now. Excited to be with the group here, trying to help out.
Yeah, no, my education is I have a master's in exercise physiology, and then I did all my concentration work in like advanced human physio. And you're familiar with like OU, like Oakland.
Yeah, for sure.
They have
really good school.
They have a medical school through Beaumont. They allowed us to do some classes, so I did like my advanced human physio through the med school. I did a pathology course with the med school. So that was most of my education. It was also all physiology based.
Yeah, it's interesting. So when I went to Michigan State for medical school, we had people with different backgrounds, like some people in business, some people in finance, some people in like nursing, healthcare, and then some people that had done like advanced physiology and kinesiology. And those people really were like well polished with like nutrition and exercise science and musculoskeletal dynamic and stuff like that. So
yeah, I always tell people, I think like the thing it helped me the most with is like if I read like a drug or like a peptide or something, like understanding MOAs, like mechanism of action, are so simple to me because of how much physio like I had to know. Because it's just so like, everything like with these, with these treatments, with these services, with the peptides, it's all just, you could break it down as simple as like this binds to this receptor, does X. Like, so that's why like learning this stuff has been always interesting, but then it just kind of comes a little bit easy to me. Probably just because of the physio background I have. Yeah,
that background too. I think people that I've been around, especially yourself and, the interactions we've had, you have a lot better application, of certain compounds, all the peptides, all the supplements, the stuff we use on a daily basis. I know you help out a lot with the specific formulations, the compound or ingredient dosing, all that stuff matters a ton.
Yeah.
Common example is like we get people in the clinic all the time. People don't understand vitamin D deficiency. We get people in all the time that are really deficient in vitamin D. Really easy to correct, really easy to supplement. And a lot of what they don't understand is where it's coming from or the specific dosing. Like people will say they're taking vitamin D, but it's dose. It's not really therapeutic. It's not really giving them any benefit. So they think they're taking it. They're just not really getting a clinical benefit out of it. So the details really matter, which is, where you come in, that knowledge and the background that you have with the specific compounds, the specific formulations, the dosing, the protocols, all that stuff makes a huge difference in getting people a specific result.
Yeah, because and on top of that, there's just so many different avenues you could take stuff. Like for example, when we talk about peptides, I've always said like I think they belong in 4 categories mostly, and that'd be like inflammatory, like support, cognitive support, weight loss, and then I would say probably like immune response is probably the next, like immune health.
Yeah.
I think you could kind of like categorize those, and then that's where like you can say like, okay, what's the main goal, right? What's your main goal? These are what we can use to like support you. And then like same thing with supplements, like we could do that a lot. And a lot of things have a lot of uses for a lot of different applications, which I think a lot of people think like this stuff's really black and white, but it's not. Like you can use things a lot differently, like a common one that we know is like you and I have talked about like GLPs, and there's just so many case uses now for it. It's not just appetite suppression or weight loss. BPC 157, right? That's used in a host of different reasons now. So like there's so many different ways that you could look at peptides specifically, because I know we wanted to talk about that today and just get into like kind of those highlighted categories and just kind of pick a few to talk about.
It's interesting in the clinical setting too. I would say, I mean, some of these have been around for a period of time. I feel like the last, post-COVID, maybe the last 2 to 3 years, there's a really big awareness for, people in the community, clients and patients in general. So like, and it doesn't really matter the age. There's a lot of younger people that are really well versed in exercise and nutrition, and they're familiar with peptides and supplements and all that. But we even have a lot of active adults that are in their 50s and 60s that have a basic understanding of peptides and supplements, and they know enough about it, and there's a really big interest behind it. And I think when you look, there's definitely, across the United States, there's communities that are a lot more active, and it depends on what area you're in. I think overall health, longevity, wellness, I think it's more on the forefront. Like people have that awareness and the reach and the interest where, they can look at stuff online, they can see YouTube videos, they can listen to people on podcasts where, some of the information isn't all spot on, but there's some good sources here and there that, people that are really well versed in their background, their education, and then the practice of what they're doing where, you can get reliable information and people have this awareness. I mean, we both live in active communities where, it's people are either doing the gym regularly or they're doing endurance training, competing for bodybuilding, or even like in this area here, we have a lot of people that are into like golf and pickleball, things like that. And we have people every single day, inquiring about peptides and supplements and what kind of recovery protocols they can do. People actually looking down the road when you talked about like neurocognitive health. I've had probably at least a dozen people reach out to me in the last 2 to 3 months, asking about peptides in relation to like, will this help my cognitive function as I age? Is this going to prevent dementia, or could it help prevent dementia? Things like that. So those different categories, I think there's a big awareness now going forward, and hopefully, peptides are good compounds overall that can help people, age appropriately and help different organ systems function a lot better.
Yeah, I remember when peptides got popular, I was like skeptical about them at first because I'd think about it, I'd be like, how is like a little sequence of amino acids like, really going to do this? But now, like anecdotally, just through myself, like I've taken so many different ones, I've seen so many different benefits. But like one of the things that is interesting is just like how people's attention to medicine has shifted so much. Like
for sure,
it's just gotten so into like they coin it medicine 3.0. Like being proactive, not react. Like you got people coming into the clinic that are asking about dementia and Alzheimer's, and they're like 30.
Yeah.
And they want to start working on preventing that stuff from now. Like getting APOB under control really early in your life. Like things like that, are what people are now learning about that could help them live longer and help them not have these problems later on.
So when you say getting that, what was it?
APOB?
APOB under control? Like what does that even mean?
So APOB is like a marker we test for to kind of see the atherogenesis risk. So like the risk of developing like plaque in your arteries.
Cholesterol and lipid related. Yep.
And just seeing like what that level is. If it's higher, you have a higher risk of developing plaque and increasing your risk of like a cardiovascular event. So getting a hold on that early in your life could essentially, prolong your life in that process. So that's why like I get people all the time that are like mid 30s that are like, can I get my APOB tested? Can I get my LDL particles tested? And when 5 years ago, nobody even really tested that stuff.
Nobody was really talking about it. Nobody was paying attention.
About cholesterol particles.
Small scale. But I mean, it wasn't mainstream. But I mean, the craziest thing to me is like, I mean, my exposure to medicine over the last like 10 to 12 years, stuff has like progressed pretty rapidly. And kind of, in certain ways, like things that you wouldn't expect. But I just had Monday, I had a 17-year-old perfectly healthy kid. Like I call him a kid. He's like basically an adult, perfectly healthy guy, 17-year-old just coming in for comprehensive labs. Great top to bottom, covered diet, exercise, nutrition, sleep patterns, how's your skin health, how's your hydration, all that stuff. And this guy's like, I still call him a kid, but obviously he's an adult. Like super articulate, super well educated, reads stuff on his own, understands his body, works out at the gym, is like, has dietary programming in place. Is like, yeah, I eat carbohydrates, but I'm selective about my carbohydrates and fats. And I'm thinking like, I mean, when I was 17, like I didn't go wild. Like we were like kind of plain eating water. Like I never really got into soda, stuff like that, just because I was an athlete. But I mean, thinking back to like when I was 17, like we didn't even have access to like protein powder, amino acids. There was no pre-workout. Like you ate what you could relatively clean, but I wasn't like sitting down with a doctor being like, can you check 50 or 52 markers for me? I want to check my cholesterol. I want to know where my hormones are at. What's my vitamin D? Like, I mean, it took me until I was like 35 to get like a comprehensive panel, including vitamin D and all the hormones and stuff like that. I mean, it's crazy now that to me, like we have these, I still call them kids, but like younger adults coming in 16, 17, 18, 20, 22 that are just, they want to know exactly where their labs are at. They want to know their exact cholesterol profile, the vitamin levels, everything in general. And they're into diet and nutrition, like, diet, nutrition principles and like regular exercise, all that stuff. It's impressive.
Do you find that like your older clients and patients are still a little bit more difficult to like get them to like take certain services or use certain things? Like, do you still feel like there's that pushback a little bit from like just what they were used to medicine being like for the majority of their life?
I agree. I think there's still like a really traditional component to medicine. I think COVID, for a few different reasons, maybe not even specifically, kind of shifted that. And I think now I would almost say not like 100% due to popularity, but when well-known people are discussing these topics and they're giving a personal experience and they're saying, I use this, or this is what my routine is, or this is what my protocol is, it really gives like a name and a face to what's going on. I remember when celebrities started talking about GLP medications, like took off, like within a few months just went crazy. And I mean, some of those medications were around for a while. I had patients on Ozempic before COVID. I mean, mostly diabetic patients and stuff like that. And as the studies and the trials came out, things shifted. But I would say middle-aged and some older adults, some are kind of in that traditional medicine, like mindset and that sort of thing. But I think even those individual people are like, they're seeing stuff online. They're getting exposure through Instagram, Facebook, YouTube. They're seeing different sources talk about things, whether it's hormone replacement therapy, peptides, supplements, vitamin D. Vitamin D got a huge push during COVID, just because they saw, people across the board that had more appropriate vitamin D levels typically had better outcomes with more severe cases of COVID.
Yeah.
So I think that like that online awareness, media awareness, presence, I think has changed people's mindset to a degree. I have a good amount of adults, middle-aged and older adults that come in that are interested in specific supplements, very specific peptides. They want to know where their hormone levels are at. Like they're at a point in their life, whether they're working or maybe retired, they want to be super active. They want to, go to the gym daily. They want to do pickleball. They want to travel. They want to go out to dinner with, groups of friends, things like that, just to remain as active as they possibly can.
Yeah, no, I think COVID was a big time where like people started self-educating more. Like the cytokine storm thing with like vitamin D was like a direct correlation.
Yeah.
Like people with bad, cytokine storms, like so pretty much just overactive immune response.
Yeah.
Was just correlated to a low vitamin D level for a lot of people. And then that got people, I think, really interested into supplements. I think that time frame,
Yeah.
like that 2020 time
I
frame,
agree.
was when people started really learning about supplements because, you know, you had fast track vaccines and then, you know, people were hesitant, you know, people are for them, whatever that might be. But
Yeah.
the supplements got really popular during that time frame because people wanted alternatives to everything.
For sure.
And then, you know, they talked about like quercetin and zinc got really popular during that time. People learning like people didn't know what like a zinc ionophore was, right? Where like quercetin acts as one, but now people know what stuff is like more people know what stuff is like that.
Yeah.
So like zinc, for example, like in viruses, zinc can help stop like replication of a virus, but zinc is a difficult mineral to get into a cell. It's hard to pass into a cell, so it needs something to help it. And quercetin is another supplement that is a zinc ionophore. So what that means is it helps zinc get inside of a cell. And you taking your zinc alongside quercetin like increases the impact it has on like stopping a virus from replicating. And that was like a really popular thing. That's why ivermectin got really popular.
Yeah. The crazy part, yeah, at that time I was working.
What was the other one? Hydroxychloroquine.
Yeah, yep.
Yeah,
that
yeah,
one was.
that's what I meant.
That one was talked about as well. I was working at like the Memorial Hospitals down in Fort Lauderdale, and I mean we were seeing like at least 20, 25, 30 COVID patients a day, and it was definitely like a hyper-inflammatory, hyperimmune response. Some people obviously had it a lot worse than others, and different things factored into that. But I would say around that time, there was more awareness for supplements. Like I had people reaching out to me asking me, should I take this? You know, should I take these supplements? Like a lot of people were, you know, taking vitamin C, vitamin D, zinc, things like that.
Yeah, during that whole time frame, I worked alongside 2 physicians to just help like with protocols and just help them with that during all that going on. And then just like the community where I'm from, like I helped a lot with just like pumping out as much information as I could on like things they could do to like prevent or just, you know, be healthier during that time. And the vitamin D, the zinc, all that stuff was really popular. But shifting like a little bit to like immune response, would you suggest like thymosin alpha 1 to maybe like somebody who might be more prone to immune issues, or is it something that we like to reserve until there's an active immune response? Really?
Yeah, so that one specifically, I had patients taking during COVID, and we typically have people taking it for 60 to 90 days at a time.
So like proactively.
Yeah.
Yep.
It's a peptide, yep.
Yeah, so thymosin alpha 1, we, you know, if somebody has immune response like issues, or if they're like exposed to something like mold toxicity,
Yep.
we can give them thymosin alpha 1 to just help their immune response with it. There are moments like with active autoimmune, sometimes we want to shy away from using it because it might amplify the immune response too much, and that person's already.
What about something like lupus? Or like
Yeah, so that's like an up for debate kind of topic with thymosin alpha 1. Like Hashimoto is another one that's kind of like, could you use this? Could it make it worse? You know, for some people it helps it, for some people it makes it worse. So really like I use it even on myself, like as onset the symptoms, like a cold come on to play. I notice my cold isn't as severe or as aggressive.
Usually at the dosing that we're at, I mean, I haven't used it in a ton of patients with autoimmune disorders. I would probably reserve that a little bit more.
Yeah.
For specific cases and, you know, look at everything collectively. I know you and I have talked about it. We've had some patients that have had certain issues where we'll check like, you know, full blood markers, high sensitivity CRP, IL-6, TNF alpha, things like that. So you can kind of make a judgment. Overall, the patients that I've had that have taken it have had pretty good benefit from it.
Yes, and side effect profile I feel like is pretty low.
It's pretty minimal, yeah.
But I mean, we worked together with one of our friends. He had a really poor immune response to a stem cell treatment, and we used thymosin alpha 1 with him, and it helped reduce his, you know, overactive immune response. I think like another nice case to put that into play is like, I think like pre-stem cell treatment is a good place to put maybe thymosin alpha 1 to kind of just get your body in a immune steady state so that when the stem cells come in, your body's not going to have that over responsiveness to them. I also like using it for people like who are trying to like maybe wean off of like an amphetamine like Adderall or Vyvanse, just because coming off of that there is a swing in immune response. So if we can support that on the back end, it usually helps a good bit.
You were mentioning the stem too. Typically, we're looking at running that like 4 to 6 weeks or so
like
beforehand.
4 to 6 weeks beforehand. I think it helps a lot with just reducing that risk, because I think a lot of people like with stem cells, especially if they're getting like high bolus doses of stem cells at once. I mean, we know just from experience, some people have bad immune responses to it. Strong or improper or bad immune response for sure. So, that's where I think it definitely has a nice play there. I use it with people too with like active gut infections, just to help with controlling like overactive mast cells because then there's just a ton of histamine production. Just helping like, aid that to calm that down just so symptoms get better too. There's a lot of cool things with the thymosin alpha 1. I think it's a really cool like immune modulating peptide. And I think it just did get fully approved. I
think it was on the list. There was a September meeting and a December meeting.
So that's great in that regard. But and then I think like it's always nice to couple like the immune modulating peptide with something anti-inflammatory. And we've always liked BPC. I think TB500 is great too. I think GHK copper is not used enough for that purpose. A lot of people associate that with like hair.
Hair and skin.
But like sub-Q injection GHK helps a lot with the inflammation, and then it also is really good at stimulating stem cell migration. That's why I was telling you I used it for my ankle, and the main purpose of like the dose we were using for it was just to get as much stem cell activity in the area, and that's why it swelled when I was taking it so much.
You get the localized immune response. What was it? You had the ankle injury recently, right?
So I transitioned from like bodybuilding to endurance training. That was like a year ago. And then I've just been running a ton. I was prepping for a marathon and then also this high rocks race at the same time, which probably wasn't the smartest idea. But I was running like 40, 50 miles a week and doing high rocks training at the same time. One day I just woke up and like I could barely like step with my toe. It just hurt so much. Like I played competitive soccer for a long time, so I thought like maybe I just like sprained my ankle. But after I realized it hurt to like propel my foot, I knew something was. So I got imaging, I got an MRI, and I had a positive stress fracture and a partially torn ligament, like which wasn't bad. It was just like grade 1, but the stress fracture was on the talus bone. So like right under the ankle joint. It's like the worst place to get one.
You're gonna feel.
You're gonna feel it on everything you do. So I used BPC, TB500, and the GHK, and I was painless in 2 weeks, which is incredible considering bone is like a 6 to 8 week like replenishing cycle.
Recovery time. The BPC and TB have been around for a while. The BPC derived like from gastric enzyme, right? I mean, that's been around for a few years. We had pretty good success overall with people using that, especially like the localized subcutaneous injects. I think that combination, I know some places do like the peptide blends or combinations. So the BPC with the TB.
That's what I was taking. Both like in one vial, which was great. And then I think BPC oral also doesn't get enough credit. BPC, like in its oral form, they connect it with like an arginine salt usually. And that, increases bioavailability up to like 90%. Like, it's still pretty localized to your stomach and your GI tract, but there are some systemic effects from it. But it is really useful for people with like ulcerative colitis, IBS, IBD, things like of that nature. I use it with people all the time that have like maybe SIBO or leaky gut or, you know, like a H. pylori infection, something like along that lines. Like BPC is a good cornerstone in a lot of those situations, just to help with all the inflammation and the healing process it could support.
I've seen a lot of younger patients that have used the oral, and they might have IBS or IBS variant, and they do well on the oral. Even 30 to 60 days in, it can have a lot of localized effect on the stomach and the small intestine, and they get pretty good GI improvement.
My wife gave birth like four months ago. She had a C-section. Our first kid was a C-section, so she decided to just have it for the second. And after I told her, I said, don't breastfeed. Just don't try. Formulas are great still. And, you know, I said, don't try just so we can get you to recover faster.
Yeah.
So we used BPC, TB500, and I mean, dude, she was up and moving twice as fast as the first kid.
Yeah.
And it was incredible. And there's even like topical formulas of BPC now and TB500. And then there's the BPC like kind of older cousin that just came out recently. I can't remember the name off the top of my head though.
Was it the Pentadeca?
Yeah, Pentadeca.
Pentadeca arginate.
Yeah, that's kind of like replacing BPC at this point, which it's because BPC
Similar structure,
so it's going to help with like tissue remodeling, angiogenesis. So like that's the development of new capillaries to like an area of tissue, just to help keep blood flow and oxygen to just help repair like the injury or whatever you're trying to use it for.
Musculoskeletal base, yeah.
Which is a big part of why BPC works so well, and TB500 also is really good for the angiogenesis portion of that. I think like TB500 for me worked the best when I was taking it every day.
Yeah.
A lot of people like to only use it like once or twice a week, which like we recommend like 2-3 times a week. But I've noticed for people with more severe injuries, a daily dose of it works better.
I totally agree. I was just talking to somebody yesterday about same concept, that BPC TB combo. If you have a legitimate musculoskeletal injury, doing that once or sometimes twice daily, depending on the total dosing of that combination, the efficacy is going to be better. You're going to have a little bit better repair and recovery compared to using it like every other day or every 2 to 3 days.
Yeah, like I always tell people too, like if you're looking to use something like this, don't be hesitant about it, because if you can start these right after the injury, the faster you get, like if you look at an injury, it usually goes through like three phases: inflammatory, proliferation, and then we have like the reconstruction, rebuilding phase.
Restorative,
yeah, restorative phase. So like with that being said, the faster you get through the inflammation phase, and the faster you get into the proliferation phase, like you can really speed up your healing time.
Yeah.
So I tell people like don't drag your feet if you just got hurt and you're maybe thinking about using it. Just use it as soon as the injury happens, so that you can speed up that first step of healing, so that you can get to that proliferation phase faster, because that's where like we start to rebuild. Your fibroblasts are starting to work again, osteoblasts are starting to work. You're starting to form all those new cells, and then over time they strengthen. But that but just like pushing through the inflammatory phase faster helps just speed up injury for a lot of people. And that's like what the goal was with my ankle, because I have races coming up, and I was like, I don't want to be like debilitated for so long.
Yeah, you got to get the recovery going and try and make the process more efficient.
I used like red light too. Like I had like a red light therapy. I had like a pad that I would just like wrap my ankle around, and then I'd use it for like an hour at a time and just try to keep it just kind of exposed to red light, like really direct right on it.
I mean, I've seen the application to use. I mean, there's obviously like people will use it like dermal issues for the skin, face area, things like that. I've seen more people use it for athletic musculoskeletal type injuries, shoulder, elbow, knee, ankle, things like that. I mean, I think there's definitely something to it. I think it's going to be more widespread use going forward. I haven't had any injuries myself that I've tried it on. I was going to say, quick aside, I had like prior, like back in the day, I ran track, short distance, and I mean now I get more or less Achilles tendonitis, tendinosis in the left side, and I use that PC TB combo, and probably within 4 to 6 weeks, my Achilles was, I mean, I would say it was like 80% better. Back then, this was like probably 2 years ago. If I would have had more access, I would have tried red light as well.
Yeah, I think red light's good. I think with red light though, I do think like if you're gonna use, don't cheap out on a cheap pad on Amazon. Like there are specific wavelengths that you want the red light to be emitting for it to actually work properly. So like be prepared to spend some money if you're gonna use a good red light therapy tool. Because there are a lot, just like blue blocking glasses. Like a lot of them don't block enough of a wavelength to actually do anything. So it's kind of just like a waste of money to be buying them. So like I always tell people like don't cheap out on if you're getting like a machine, or if you're getting like a pad. Like the more expensive ones are sometimes they're just better because they just have way more light emission. They just work a lot better. But people also like to, nickel and dime everything. So they go to Amazon, they type in red light therapy, and then they just pick the cheapest one.
Usually some of those devices, I mean, to a degree, you get what you pay for. I mean, any of the newer technology is pretty, there's a cost associated, whether it's red light or like direct current TENS unit or, some of those
I
recoveries.
haven't used one of those, but no, the red light was good. I've actually used red light with scars, so like topical BPC, and then apply that to the area, and then use a red light right on top, and I've seen scars regress like 50-60%. Like my wife's C-section scar has gotten better, which is pretty crazy to think about. That's a scar that's a 7-layer scar essentially. So,
it's deep. It's not just a superficial.
Surface, so no, there's some pretty good effects with that. And then earlier you were talking about like even younger people finding interest in like cognitive health. I think that's also pretty interesting, especially with the research we know with like Alzheimer's, dementia, Parkinson's disease. Like peptides are seeing a huge influx in like attention in those disease progressions. I think that's something that we're going to see way more people finding interest in, because of the people are learning more about like how inflammation starts to affect your brain. And build up like those issues.
Which is interesting. That goes back to the GLP medications and, a relative anti-inflammatory effect, decreasing glucose, improving glucose, and decreasing systemic inflammation. And then like peptides, we were talking about it recently, dihexa and FGL. Some of those, there were some like very small scale prelim studies on dihexa as a peptide, that could potentially have neurocognitive benefit or help delay or prevent dementia, things like that. So I think some of those peptides will come along the next few years. Hopefully there's more research, at least from a dementia or a neuro standpoint, to see how things actually affect like individual neurons, neural coding, synapse effect, things like that.
Yeah, well, the dihexa is really good for like neuron regeneration, synapse like improvements of like efficiency and synaptic activity, and that's why I think dihexa is a nice complement for methylene blue users, because sometimes methylene blue users just use too much every day. And then there's just too much like cerebral activity going on. You need to take a break, and then the dihexa kind of complements it to maybe fix any of the potential like damage that methylene, like the chronic methylene blue usage did. That's why when you showed me dihexa, I got really interested into it, because I saw so much potential of like where it could be used in like these cognitive protocols.
It's super interesting. I think all the research that you could find online, or I think that's still out there now, I think a lot of it was smaller scale, like animal studies, things like that. But I mean, going forward, maybe in a few years, if it comes back more, if it's more prevalent, or if FGL kind of takes over for that, I mean, I think there's there's definitely more emphasis on neurocognitive research now, especially dementia and the different types of dementia. So hopefully, I mean, if that progresses, with computing technology and, maybe some compounds, either peptides or different pharmaceutical options, it's going to be interesting to see what happens.
Yeah, I know that's like we were talking about earlier, but there was that phase 2B trial with GLPs, 205 Alzheimer's patients showed a 50% regression, which is insane to think about.
Yeah.
I mean, Alzheimer's and not Parkinson's, but Alzheimer's itself was just looked at as like an incurable disease.
Pretty much.
Or like a disease that we can't really slow down the progression of.
Yeah.
And now it's, talking more about, is it something that we can slow down? Is it something maybe, reverse? I don't know. But early on studies are showing good benefit. So, and a lot of that comes down to just all that inflammation. That's why I always tell people, like, the worst thing you could let happen to you is get insulin resistant. Like, that's just like the gateway to you having a ton of other health issues.
Cascade of inflammation. And it's
all that cascade of inflammation that insulin resistance causes. I mean, don't people call Alzheimer's like type 3 diabetes? Wasn't that like its nickname for a little bit?
Some people, yep.
Some people like claim that. And I know, depending on your take with him, but like Gary Brecka's like said, like type 3 diabetes is what they call Alzheimer's, but that's just the connection between the inflammation that like high glucose can cause inside the brain, and then that's linked to like an increased risk of Alzheimer's. So the GLP-1s have been showing reduction in neural inflammation through you being able to utilize your glucose better, which is incredible to think about.
Yeah, I think the studies that are going to come, I mean, we've already talked about like the cardiovascular, and some of those were from 2023, and then the neurocognitive studies that are coming out. I mean, I'm sure there's going to be a ton more in the next 2 to 3 years.
No, I think so too. And then I think good complements and all that will be like your mitochondrial based like peptides that, help with like fat loss and things like that. Like aside from like your GLP-1 family, but like MOTS-C.
Yeah, I was just going to say MOTS-C. We used to have people, that were regularly asking, or like people that were well informed about MOTS-C, which seemed to have a pretty good metabolic effect.
Yeah, MOTS-C's got a great metabolic effect. 5-amino-1-MQ does. Yep. What else is there? There's a new one. It's not. We probably won't have it in the clinics for a while, but SLU. Have you heard of SLU?
Yeah.
Yeah, SLU is pretty interesting. Just like causing these exercise-like adaptations without actually exercising. Like, that's pretty crazy to think about. Yeah, it's SLUPP322. That's
it's got a longer name.
That's the full name, but no, it's an oral. It's just a pill that you take, and it's shown in animal models, like
basically to mimic exercise.
It just mimicked exercise-like activity without actually exercising, which is pretty crazy to think
I actually
about.
had one patient that had heard about it recently and asked me if we could if we could source it or find it. But I mean, it's definitely interesting.
Yeah, it's really new too.
Like, would I get the same endorphins?
No, it's not like that.
Like sitting on the couch?
Yeah, no, it's not like that. It's just like from like a mitochondrial like biogenesis standpoint, from how you utilize fats, how you utilize carbs, like what training supports, like how you develop training adaptations to all that. SLU does that to a degree without doing the training, which is pretty. I mean, that's pretty wild to think about.
That's crazy.
But I know a big issue a lot of people do with these mitochondrial like peptides. They take too many for too long, and it actually just puts more oxidative stress on your mitochondria in the long term. So like I always tell people, like, alternate between, like, if you're gonna take your MOTS-C and your SLU, take one every other day. Don't take them together.
Yep.
Because just too much mitochondrial stimulus is just going to cause oxidative stress potentially.
I would say over the last 2 years, we would have people run MOTS-C for sometimes 3 to 6 months or so, but we weren't stacking it with a lot of other.
That by itself.
Pretty much, yeah.
Yeah. And then like MOTS-C, we usually say like what, 2-3 times a week injection.
Yep.
It's not
I
like
think
a daily.
We were doing about 3 times a week.
Yeah.
Yep.
Yeah. And then I think MOTS-C, I think you could even stack in like an NAD plus injection into that
Yeah.
category.
That would be fine.
5-amino 1-MQ would be a good addition to that whole. I feel like those 3 together would be enough for like if you're looking to like amplify like mitochondrial activity, help with fat loss a little bit, help with, your ability to train at like an endurance level a little bit higher.
It's almost like a recharge or a reset. It's almost like recharging a battery to a degree. So any like activity, exercise, it's going to place like stress and strain on your body. There's going to be, in simple terms, kind of like oxidative stress or kind of wear and tear to some of the processes that are going on in your body, whether it's on a cell level or protein synthesis where you're, trying to repair or rebuild muscle tissue. Those compounds just kind of assist in kind of the energy or metabolic processes. So it's kind of like recharging a battery on a phone or, like kind of a full reset or a full recharge in order to get you back to like a steady state level that you were, before like activity or exercise.
Yeah, that was a great way of explaining that. I think
kind of a recharge, and people will say that too. Like we used to have people just on MOTS-C, and they're like, I have a guy that's in his 50s, like used it, for periods of time and super active, wasn't doing any HRT, was like great on the MOTS-C, was basically doing like MOTS-C, magnesium, vitamin D. That's it. Super healthy guy, played college soccer, just exercised almost every day. I mean, this guy was in great shape. He's like 55, 56. And he just said the MOTS-C, huge improvement in energy, how he felt during exercise. His exercise capacity was better, like doing cardiovascular exercise. And then the recovery was better.
Yeah. Like I've taken MOTS-C. I take 5-amino right now. Obviously, like I train endurance focused, but I also feel like my capacity to train has gone up a lot ever since taking them. I also have a blood disorder, beta thalassemia minor. So like my hemoglobin per red blood cell is low. So my oxygen transport's not ideal. And then my carbon dioxide disassociation is also not ideal. So like endurance sports are probably not what I should even be considering.
It's a good challenge.
Yeah, exactly. But I've noticed that that's gotten a lot better ever since starting like MOTS-C, since using 5-amino. I think just my efficiency in training has just increased because of those compounds.
I would say we've had over the last year a lot more patients using 5-amino. Like great overall. I mean, almost everybody responds to it. And I would say from like an energy, fat metabolism standpoint, I mean, activity levels, like exercise capacity, what people can do definitely improves. People feel better on it on a daily basis. Body mass, body composition's improved. Similar kind of what you were saying before with, between NAD, 5-amino, MOTS-C. I mean, NAD, we have more and more people coming into the clinics that are, originally people were doing a lot of NAD in the IV. We have a lot of people doing subcutaneous injects now that are having a really good clinical response from a cognitive standpoint, energy, exercise capacity, day-to-day function.
Yeah. I think it's important too for the NAD like for people listening who like using NAD, the infusions are great, but they'll only really keep you elevated for like 24 to 48 hours.
Yep.
So that's why you probably need something in between your infusions. So like, taking home that sub-Q push, or even using like Niagen, like a precursor.
Yeah.
Just to hold you over until is something that I don't think a lot of people realize. Like they come in, they get their NAD like IV, and then they wait a month to do it again. You need something like in that interim, That's where like a sub-Q injection comes into play. That's where one of those like a Niagen comes into play, just to help carry you over. And then like 5-amino is a really good complement, right? Because it keeps NAD levels a little bit higher. So that's like one thing I think a lot of people mistaken with like NAD plus. And the IV is not the most comfortable for some people. They get that like just that heat sensation in their chest at times.
Discomfort. Yeah, it's a little bit longer process. Yeah. It's like more of a time commitment, and you're
on that IV for a while.
Logistics it's a little bit more.
Yeah, but I think like those are all really some of the best, more popular peptides. Oh, and then ones we kind of forgot about actually were like the GH family.
Yeah, GHRPs.
Yeah, like all your secretagogue based, products, ceramorelin, ipamorelin, CJC, tesamorelin. Yeah, tesamorelin's got more popular. It's got like a cost barrier to it. It's a little bit more expensive. I like ceramorelin. I use ceramorelin with people a good bit. I think that before bed, I get really good IGF-1 scores on blood work after it. I think it works really well.
Yeah, I'm using it right now. I've tried, obviously for guys, we typically, most of the time we prefer subcutaneous injects if possible. I'm trying dissolving mini tabs right now that are just sublingual mini tabs. I feel like the efficacy is decent. I'm going to do lab work coming up. But yeah, most of the time when we're using those compounds in the subcutaneous injects, we will see symptom improvement, but we can see it in some of the lab markers, especially the IGF-1. There should be a reasonable clinical improvement or clinical response based on that, just even within a few weeks. So there's definitely a positive effect. I mean, when people are consistently using it, we're going to see an improvement.
I think it's important to talk about, though, like if you're using one of those and your growth hormone is high on blood work, it doesn't necessarily mean that your IGF-1 levels are high, though.
Yeah.
So, like, it's important to, if you're using anything like that, get your IGF-1 scores tested, too, because your GH might come back elevated, but you might not be, like, processing and metabolizing properly to IGF-1. So I tell people, like, just because your serum GH is high doesn't mean your IGF-1 is always, because I've seen it happen where, like, these guys have had really high GH, but then their IGF-1 is like normal.
Yeah.
It just doesn't like add up. So I always tell people, just if you had to pick one to test, I would tell you to test your IGF-1 over your GH marker. I think that's a nice complement to just making sure that it's working well. And then some people who get like the insulin sensitivity issues, like from higher growth hormone, I feel like that's where 5-amino plays a nice like role to just improve glucose metabolism. That's just not another injection, just like an oral.
Yeah, oral
compound.
capsule. Yep.
I think it works really nicely to like complement together at the same time. That's like a combo I give to a decent amount of people. Ceramorelin and 5-amino.
Yeah, those peptides work really well. I mean, I would say especially in younger patients. So like we'll see patients in the clinic that are in their 20s, 30s, 40s. Sometimes we'll see the IGF level that IGF level come down, and it can be like, systemic or, external factors playing in, like weight gain, decreased activity, sometimes external stress. We have people that work overnights in a hospital or with the fire department, things like that. So things that are disrupting the sleep schedule, we'll see those IGF levels come down. A lot of times people will get, more or less symptomatic, and that can also sometimes correlate with hormone levels to a degree, or vitamin D, if people are deficient in hormones or vitamin D. But usually when those IGF levels are down, when people are on those peptides consistently, a lot of times we'll do the 5 days on, 2 days off. If people are on those for a period of time, we always see pretty solid clinical improvement. So it's having that effect on the pituitary, where you're helping your pituitary function better, so that you're getting, natural.
Your natural pulses are higher.
Yeah, natural growth hormone production, where in my mind, it's more of like a positive feedback mechanism rather than negative feedback. When you're introducing like exogenous growth hormone, like a somatropin or, genotropin, nortotropin, any of those compounds, you're more or less getting, somewhat of a negative feedback, just like taking thyroid hormone or testosterone. Your pituitary and your hypothalamic pituitary axis is getting a negative feedback mechanism. The peptides do a really great job where it's more positive feedback. So when you're taking it, your pituitary functions better to a higher degree, and you're getting those recovery processes.
That's why I think like with with like those, it's nice to kind of match with your natural pulse, whereas like your genotropin, you kind of want to take it away from a natural pulse so you don't possibly like suppress what your pituitary was gonna, produce in the first place. So like it's kind of the opposite.
So typically for those like the GHRPs, like, I mean, obviously I take them as well. What's your dosing, or what do you like for, like if it's the average, like middle-aged guy, or like, let's say a 30-year-old female?
Yeah, I usually do like 200 to 300 micrograms of sermorelin before bed. Again, just to help that natural pulse that happens while you sleep. And that's usually what I start with, and just, work up based off bloods. If bloods need if we can use a little bit more, we will. Or if they don't respond well, we might switch to like CJC IPA combo. Because that's really popular now too.
They have, I think, for like we've had success with females doing like a 300.
Both of them, right? Yeah.
Yep, they have a 300, sometimes a 500.
Yeah, and that works well. I feel like 300 micrograms for like all those products works
pretty good.
Yeah. And I don't think it's one that you need to like scale up super high or anything like that. Yeah. I mean, we've obviously have come up with like therapeutics for like different goals. And like depending on the goal of the person, maybe there's reason to shift, but for the general, I feel like it works really well.
Yeah, most of those doses, especially those at about 300 mcg, it's going to target the receptor and do what it needs to do.
Yeah, it does everything it needs to do. But like I was talking to you earlier about like people who like have higher training, or just who have a lot of metabolic turnover every day and just are, working through a lot of calories, a lot of just metabolic just response. Sometimes I feel like we do need a little bit of a higher dose on some products just because their turnover is just so high and so fast. That's why like 5-amino, for example, like I usually recommend 25 to 50 a day. I take 100 a day. Why do I take 100 a day? It's more so I also probably train a total 3 hours a day between 2 sessions. So I have a ton of turnover happening every day. So that's like something to consider with just some of these products. You would have to like kind of address and look at, all right, what's this total metabolic turnover for this person too?
I would say for younger people, the standardized dosing usually gets us a good clinical result. Sometimes for middle-aged or older adults, it depends on everything collectively, like exercise and their profile and all that. So sometimes we'll dose patients a little bit higher, but depends.
Yeah. Yeah, I know. I mean, I think this was a phenomenal topic for us to talk about. I mean, we use peptides every day. So
I know you and I are both big fans of peptides. I know a lot of the guys here are as well. So I think the application for the peptides is great because, well, the one thing I was going to mention earlier too. So I'm usually, if I go through and I meet with patients, younger patients, I like to optimize everything we can before just going to hormone replacement therapy. So obviously specific indications, if you're going to use hormone replacement therapy, depending on what exactly is going on, you really got to figure out what the deficiency, what, if it's primary or secondary. Most people, it's going to be probably secondary. In like premenopausal women, younger women, we've had a lot of success using the peptides, and that could be a profile of a younger female that's working full time, that has a lot of stress, is exercising and needs that recovery. Or it could be a female that, just had her second child and is still working full time and, has a really fast paced lifestyle and maybe the sleep's not that great. So like, instead of like traditionally where, some places might just throw hormones, to women, like you can get women feeling better and functioning better on a daily basis with some of these compounds where they don't have to rely on like an amphetamine or caffeine or a stimulant or hormones or things like that. Like you can utilize these peptides, and like a 28, 30, 35, 40-year-old female can have a huge improvement in energy, exercise, recovery, big improvement in sleep, hair and skin, which is important. So utilizing those, I mean, that's where we saw like CJC and ipamorelin, females would have a really positive response to those. And it was like multifaceted. It was like energy, lean skeletal muscle, sleep, hair and skin's better.
Help with recovery and stuff from giving birth, like postpartum.
Yeah. So I would say from what I've seen clinically, obviously I'm not a female, so I can't 100% say from a female standpoint, but the female patients that we see and follow, it can take, there's two things: females that are on like birth control and females that, have given birth, past like postpartum. Those can change hormone profiles for sure. Letting your hormones kind of balance and reset and rebalance, like it can take 3 months, it can take 4 months, 6 months, 8 months. It can take females a period of time. I mean, roughly probably 6 to 12 months to rebalance and get back to where they're at. Sometimes you don't fully recover, right? If you're like, depending on your age, and it's like your second kid, your third kid, a lot of women work now like full time, so they're full-time responsibilities, all this stuff. They do get a good effect, like monitoring those levels postpartum. So like I've had patients in the last month or two that were anywhere between 12 months postpartum or less, and you can start to see some of the hormone levels rebalancing to a degree. And if it's on the early side, if it's less than 6 months, I don't think it's necessarily incorrect to start a peptide. Obviously we'll make sure to see if they're on any compounds, medications, if they're breastfeeding, what the routine is. But we've had females that are at that 6 or 8 month mark where their hormones haven't really fully rebalanced or improved or rebounded. And if they have specific symptoms, that case, like, some of those peptides like CJC, tesamorelin, they can be really beneficial in improving multiple clinical symptoms that females are having.
I've seen a lot of really good improvements in the female population with the like the growth hormone secretagogue like family. I think they work really, really well. I think like to Hannah's question too is like postpartum. I think even from a healing standpoint, we know how much like higher growth hormone levels aid in all of that too. Again, like part of my wife's protocol was sermorelin with it too, and I mean she healed a lot faster than she did with the first kid. So I would attest to all those things really working in that
great
case.
Application.
Yeah,
for sure.
Great application. It worked really well for her.
Things that we see or notice like relatively quickly, like I would say patients like men and women will notice a change or an improvement in sleep.
Yeah, sleep
energy
I think
levels
is what then turns into energy, mood. Like the sleep improvement is probably the biggest thing that you see kind of cascade into like daily life improvements, how their mood is and things like that. Because like growth hormone is just so supportive to sleep cycles. And if you can improve the sleep cycle, you get more restorative sleep, then they just, over time, I mean, your hormones will just get better with more restorative sleep. So that's, I think that's like the effect of how these people, feel better, like mentally too.
Yep. Pre-COVID. At the time I was just doing all like hospital-based, like clinical medicine, but for me, it was more from like an athletic performance standpoint and more like comprehensive health and wellness, focusing on, the lab markers, where things were at in correlation to how do you feel. Obviously like hospital-based medicine, a lot of it's like chronic care, reactive medicine, so getting into that like proactive or preventative health and wellness, like for me, like that's the big draw, right? Like how, instead of just taking care of people when they're having issues and falling apart, like how can we prevent all that stuff? And a lot of it we already know. Some of it we know from other countries. I mean, when you look at other cultures in other countries, people that are really active, and diet and exercise is a huge component of the culture and the lifestyle. I think it's all there. So like for me, like how can we place more of an emphasis on like lifespan, longevity, and preventative healthcare, keeping people as healthy as possible, not just treating stuff as things go along.
When did you leave the hospital, like officially?
Officially, it was like May of 2024.
Okay.
So pretty recent, about a little less than a year ago.
So you still were seeing patients?
I was still seeing, patients up until about like last May.
Okay. Yeah, I don't know. I thought you had left earlier than that. It seemed like it.
Probably could have. Could have.
Were you contingent there? or
that was just I had at one point I had like 3 or 4 contracts,
Okay.
and then it went down. I like kind of narrowed it down to like 1 contract. So like the scheduling and all that stuff wasn't bad. It's just at that point it was a lot. It was way more of a focus on like chronic care and chronic management rather than, I mean, there wasn't a lot of like preventative health and wellness that you could actually do.
Yeah,
so.
and I think like, you talking about like proactive care, like I feel like that's like the term functional medicine gets tossed around a lot. Now a lot of people don't like, I don't even think there is a true definition of it, but I think like when I think of functional medicine, I think of like, how can we be proactive against something? How can we, look at your blood work and then, connect the dots between different systems and how different systems are affecting each other. Just because you fall in a reference range doesn't always mean that you're in a good spot.
That's very true.
The reference range for testosterone for a female, is like 20 to 65. Like some females might feel miserable with a testosterone of 20, but they're not outside the reference range, so they don't qualify for TRT yet. But, with functional medicine and like concierge medicine and things like that, we can optimize that. We can make those people feel better.
Yeah.
And I think that's what like functional, medicine is. And then I do think people are realizing too that like insurance companies don't do the best job at like authorization of tests, because it's all like a criteria thing. Like to get like a reverse T3 test, you have to like have a bad TSH, then a bad free T4, then a bad free T3. Like you have to do 3-4 tests before you can even, get approved for a reverse T3.
It's the
Not the
healthcare
doctor.
Yeah,
That's
the
what
healthcare
realized.
system's wild.
It's the insurance company that the doctor is affiliated with. I've realized that.
Like the government more or less has allowed insurance companies to direct and dictate healthcare for like the last 20 years, and it's been like more of a slippery slope.
Yeah.
So everybody that falls underneath insurance, which is everybody, most, like get wedged into like you're like at the tail of the train. Like consumers have no power and no leverage and little say. Doctors are a step above consumers. Hospital systems have some bargaining or collective leveraging power, but they're still under the insurance companies. The hospital systems they get jerked around by the insurance industry and the government, and they just have to follow the rules and regulations. And like whether you're not for profit or for profit, you still don't make a lot of money. And in the end, the people that get hosed the most are the consumers, which are you and me. Like that's the important part of the healthcare system. It's the people that you're actually providing the care to, and they're like at the bottom of the pole, like which makes no sense at all. The only thing, and it's a topic for another huge conversation, but like I think when the government migrates and like people get a little bit more progressive, like there'll be other models of healthcare that will come in. Doesn't mean we have to have socialized medicine, but there's direct primary care models that are pretty well established. And somebody like you or me could pay $100, $200 a month for a membership. It's like a gym membership. It's like an all-inclusive gym membership, and everything's all-inclusive. Like you get doctor's visits, sick visits, annual physicals, lab work, medications if you need it. There should be diet and exercise counseling or programming built into that. Some of the offices do it well, but the direct primary care model, going back to what we were talking about, like you don't need to order 150 tests on every single person every 6 months, right? Like at some point we have to have a cost-effective or cost-efficient healthcare system. So how do you get a cost-effective healthcare system where the consumers don't have to pay $15,000 a year for premiums and get nothing out of it? The hospitals don't get screwed out of money, and maybe an insurance company gets something, but like United Healthcare isn't making $80 billion in profit, right? Because like, where does that all go? Well, it goes to stock, shareholders and dividends and all this. It's wild. Like, so there should be more efficient healthcare models coming in, and like some of those direct primary care, like you can pay a membership fee and get a lot out of it, but have cost controlled. So like if one of us wants to get labs and we want hormones, we want vitamin D, we want IGF, like that can be covered at a reasonable cost, instead of a female going to an OBGYN doctor and them saying, nope, sorry, we're not going to run it. Insurance says we can't do it. I can't justify it under codes, and my billing and coding person can't push it through. And we already know if we draw it, we're going to get stuck with the bill. Then we're going to pass the bill on to you. Then you're going to be stuck with the bill, and you're going to be unhappy. It's such like a circular. It doesn't make any sense at all. That like the physician, like in my position, they're already programmed to know we're just not going to deal with this. We're not going to order it. Which again goes back to the consumer, the individual who's not getting the healthcare that they want and need. It's insane.
Yeah. No, we could talk about this.
Oh my God, the healthcare stuff. Yeah. So hopefully, like our generation, like I'm obviously older than you guys and all that. Hopefully, I don't know if it's direct primary care that's super cost effective and you pay a small membership price. Maybe you carry higher deductible insurance. There's got to be like, we have the smartest people in the world. And like the fact that health insurance has gone sideways and down the last 20 years, to me says, who's controlling all of that? Probably the health insurance companies, lobbyists. They're jerking the government around. The people that we elect for politicians are like, okay, because they're getting money stuffed in from United Healthcare or whatever company. And then ultimately the consumers get left nothing.
Yeah.
And they get crappy coverage. They still have to pay a lot of money into the system, and they don't get anything that they need. It's like, that would be like if every time you went to the grocery store, they were going to charge you $500, but they would give you like a pickup truck full of groceries one time, and then the next time you'd walk out with a bottle of water. And you're like, okay, that's not fair.
Yeah.
It just doesn't make any sense.
That's a great analogy. That was a great
You're
analogy.
either getting a lot, which is probably not only going to happen once a year, or you're going to get nothing the rest of the time. You're going to get a box of crackers one time. The next time you're going to get 3 bottles of water.
Yeah.
Next time you get 2 slices of turkey.
But that's
stupid.
But that's where I think like now, like what you practice is where probably why you're starting to get just more and more like just average Joe people coming in.
I give people like, I literally like, I'll set like, I can deal with insurance if we absolutely need to. I do stuff for a cash pay price. I set it as low as humanly possible where I cover everything that people need. So like people that are signed up with me, their labs are covered, annual physicals, EKG. Like they don't have to guess if they're going to get an $800 bill from Quest. You don't.
Done.
We get the bill. We pay a nominal price for labs that are, again, cost effective. You don't have to worry about it. You're not getting a bill. You're not getting an extra charge. It's included in your price. The price set as fair as possible. I'll cover everything that you possibly need. So in my opinion, I think that's the best system. Now, obviously, like if you need an ACL surgery, I can't do that. An orthopedic surgeon is going to have to do that. But I still think they could find an insurance model where you pay a nominal premium in and there's a higher deductible and you get like larger scale coverage. But again, it goes back to cost effectiveness. Why do the hospitals charge $3,000 a night for a hospital room? It's not. I mean, you can stay at the Breakers for $3,000 a night.
We got our bill after the C-section.
It's insane.
It was like $35,000. And like our insurance covered up, we ended up paying like $2,000.
I literally saw a guy, I'll never forget this. I was in residency. It was like 2012. A guy went into the hospital around here for chest pain. He had at that time, I want to say, so this was like 10 years ago, chest pain, admitted for 2 days. It was like a $25,000 bill. And literally there's like line items at that time. There were like line items, like each night was like $3,000. That's just a room. That doesn't include IV fluids were like $800. Each individual aspirin tab was like $5.75. You can get like a
bottle of 100.
You can get like a gallon-sized tub of aspirin for like $10, and they're charging this guy $6 a tab for Tylenol was $9 a tab. It's like,
yeah, ours was itemized out like that. It was crazy. It was crazy to see that. And then I was like, man, how do some of these people how do some of these people have a baby without insurance?
Like a heart monitor in the hospital is like, I forget the exact price, so don't quote me on this. Like a heart monitor to like somebody that they pay like $20 an hour to monitor in a monitor room, and the device, they charge like $1,500 a day for telemetry monitoring. I don't even think the device is $1,500.
Yeah.
Again, like, and they set the price so egregiously high. Another common example is like if you get an MRI in a hospital, it's like $3,000 or $4,000 probably on average. If you go out
after a car accident, and it was, I think, $13,000.
Stupid. I literally went down the road to a radiology center here who does a great job, Radiology Imaging Associates. My left shoulder MRI was like $240 cash back.
I walked in at a place, did my ankle, $290.
$240.
Yeah.
So, like, why is it $4,000 in a hospital? Somebody can answer to that.
That's no, it's a sad thing to think about. That
It's wild. Hopefully, we have enough young, smart people. Not that the older generations aren't, but like nothing's happened around healthcare since 2005. Nothing's happened in 19 to 20 years. Nothing. Except insurance has gotten worse and the care has gotten worse and there's more of a stress on the healthcare system. Like, we have enough up and coming people in like banking and finance and marketing. Like, people can figure out like a solution to the healthcare system.
Yeah.
Like, it's got to happen.
Yeah. No, I agree with you. All right. That was a good podcast. Thank you for watching. This podcast is intended for general informational purposes only and does not constitute the practice of medicine, nursing, or any other professional healthcare services, including the provision of medical advice. Listening to this podcast does not establish doctor-patient relationship. Any use of the information provided on this podcast or materials linked from it is entirely at the user's own risk. The content of this podcast is not a substitute for professional medical advice, diagnosis, or treatment. Users should never disregard or delay seeking medical advice for any health concern they may have and are encouraged to consult with their healthcare professional for guidance and care.